President Barack Obama signed the controversial health care bill into law. Yeah, but the fight is far from over as senators take up the fixes approved by the House. Republican opposition is only hardening. GOP lawmakers in the Senate are pledging to introduce amendments and demand readings of the bill in an effort to slow down the vote that only requires a 51, not a customary 60 vote majority.
The Arc of Spokane, an organization which serves people with developmental disabilities, says not everyone it serves is supportive of the bill, but there are parts it's hoping will improve access to health care. Number one, the bill will prohibit private health insurance exclusions for pre-existing conditions. Number two, the bill eliminates annual and lifetime caps in private insurance policies. And number three, the bill restricts the consideration of health status in setting premiums. KXLY4's Tori Brunetti spoke to a mother whose daughter was born with a developmental disability, and she's hopeful this bill will help families like hers.
She is hopeful. Darci Osborne's daughter has cerebral palsy, and she spent the first 8 months of her life in the hospital. Fortunately, the Osbornes had private insurance. Today, Zoe's health care comes from a form of Medicaid. Darci says every year they have to reapply for coverage, and she never knows if Zoe will be reapproved.
Who is that? Zoe, yeah.
Zoe is a curious 7-year-old girl with a charming smile.
I really believe that there's nothing that she can't do.
Since Zoe was born, her mother, Darci Osborne, has been fighting to get Zoe the care she needs. Zoe has cerebral palsy. She has a feeding tube, needs physical, speech, and occupational therapy, and sees several specialists.
She has had to see an endocrinologist, a pulmonologist, she had a cardiologist.
Zoe was on private insurance for 2 years. During that time, the Osbornes paid $20,000 out of pocket. Combine that with high premiums, and the cost was too high.
I don't think that Bill Gates' children should have better access to health care because he has lots of money. I just don't think that. I think that it's a basic right. Stand up.
Now Zoe is on a form of Medicaid for moderate income families, and a few dollars more a year in her husband's income could stop her daughter's coverage.
Every year that they requalify you for insurance is very stressful.
Darci hopes the health care reform bill will allow her to have more options. Darci says if a private insurance company would cover the care Zoe needs, she would switch in a heartbeat. She just wants quality care for her daughter.
The therapies are still really making a difference in her life.
Progress that Darci thinks has no limits.
I think you have a lot of potential, don't I?
Yeah.
Yeah.
And Darci says she doesn't think the bill is perfect, but it's a start. She hopes people will continue to stay informed and continue to advocate for better services. In the newsroom, Tori Brunetti, KXLY4 HD News.